Going into surgery, I was afraid thought I was going to like move or twitch during the surgery.
Well,
that's very scary,
That's actually interesting because we don't paralyze you for the surgery. We actually have to make sure that the nerve is working.
When I tell people that I'm in recovery from brain surgery, they looked at me and they're like, well, you look fantastic.
All right, this is Dr. Lee. I'm here with Elizabeth Jackson, and she just had translabyrinthine surgery for acoustic neuroma just a month ago. And I thought I would ask her some questions about what she thought the surgery would be like and what it turned out to be.
I was only in the hospital for like 4 days. And even going home, I thought I was going to have a lot of issues with I live 2 hours away from the hospital. So I thought I was going to have issues in the car, which there was no issues at all. I liked the thought process and every aspect of the procedure. Everybody was very nice, very informed when I had questions. Also with the shaving of the hair, they took a lot of thought into the way they shaved it, because now you can't even tell I had anything done. When I tell people that I'm in recovery from brain surgery, they looked at me and they're like, well, you look fantastic.
Yeah, actually, I sometimes tell patients that translab, the nice thing about it is that it's more of an ear surgery than it is brain, in the sense that the cut's going to be closer to your ear, and we're going to do everything. And I find that the recovery is a little bit faster sometimes than retrosigmoid surgery.
Yes.
Or suboccipital. Yeah. What was the scariest thing before all this?
The thing that scared me is because going into surgery, I was afraid that, I know this probably sounds really weird, but I thought I was going to like move or twitch during the surgery.
Well,
that's very scary,
That's actually interesting because we don't paralyze you for the surgery. We actually have to make sure that the nerve is working, so we're testing that actually the whole time. So sometimes patients do move, and then I'll yell at the anesthesiologist, like, stop patient moving. So that can happen, but I don't think that happened in your case.
Okay.
You didn't have much hearing to begin with before surgery?
No, I haven't. My grandmother had hearing issues, so in the beginning I just thought it was age-related. But once we got the MRI and they told me what was actually happening, so that's why as soon as I found that out, I had them sent, because I live in the Wyoming Valley area, Scranton-Wilkes-Barre area. Once I found out what I had them send everything to Penn. I thought everyone here had a better grasp on what I had.
Yeah, we certainly have more experience than most, and it's an honor to be able to take care of people and be able to do this.
Well, I'm very grateful that you guys are basically in our backyard.
1 month out from
Yes.
acoustic neurosurgery. She's doing great. So we'll just follow you, plan for MRI at 6 months, just to be sure. If there's no tumor we see on that scan, we'll go 1 at 2 years. If nothing there, 1 at 5 years, and then you're done. All right, very good. Oh, any last advice to other patients who might be choosing to do surgery?
If you're going to get the translab surgery I would highly recommend Penn Hospital. Because everybody here, from start to finish, from the person taking you to your car, everybody was very nice, very respectful.
Very good. All right, very good. Thanks.
Thank you.
All right.